Jane Harris, an infection control coordinator.
Okay, great. We're talking about the flu.
Right.
It is really widespread in most of the country, really, but
Right.
Right here in Middle Tennessee, tell me some of the precautions you guys are taking.
We're taking precautions with, first of all, we started with our staff that have not been vaccinated, that they will wear a mask if they're in the clinical area so that we can protect our patients and our other staff members so that they don't get the flu. We're starting to put up posters at the entrance areas of the hospital to kind of alert visitors to not come in to visit if they have flu-like symptoms like fever, cough, things like that, trying to keep our patients at a safe environment.
Do you know, is the CDC recommending that hospitals limit visitation now because of the flu?
I have not heard that.
Okay. I saw something on Facebook this weekend, but
so I really couldn't comment on that. But no.
Yeah. Okay. And then you guys, you were mentioning with the posters, you are encouraging people to sort of limit their visitation, just
right,
kind of taking
right.
that on voluntarily.
If they have flu-like symptoms, yeah.
Okay,
yeah.
cool. Tell me why this is so important.
It's important because there is a widespread increase of the flu. We've been tracking it probably since October 1st because it's reportable to the CDC as to what our cases are. So now we're seeing an influx in the cases, and so we want to try to contain that so that we're not spreading it further and further, particularly with the early age and the elderly patients.
Is the influx this early in the season, is that surprising?
It is not too surprising because we have seen it this early before, but I don't think it's actually come to its peak yet. There'll probably be sometime in January and February that we'll see the peak increase a little bit.
So it could get worse even.
It could get worse.
Wow.
Yeah.
Julie, I think it was you this weekend mentioning that in the hospital, just in like an hour or two time period, there were 8 people.
In the emergency department, they tested 6 individuals. They tested positive for flu in an hour.
Right.
In the ED.
I was just looking at our reports for this last week from January 1st to yesterday, and we had 17 cases that tested positive, 12 of them being adults and 7 of them being children.
Wow.
So there was 19, yeah.
So when you see those sorts of numbers, what does that mean to you?
There's an outbreak. I mean, there's definitely an increase and an outbreak, and protection measures need to be put into place to keep everybody safe.
People might not be taking it seriously because flu seems like just a common illness,
right.
But it can be deadly.
It can be very deadly. Is that the complications are, the pneumonia and some other respiratory illnesses that people can get into trouble with, and there are deaths that have already been associated with the flu.
Here in Middle Tennessee?
Here in Middle Tennessee.
Really?
Mm-hmm.
Do you know much more about that?
No, I don't.
Anything? Okay. All right, so anything else that you want people to know about this?
Probably the most important precautions is take the flu vaccine. It's not 100% effective. It's probably 60 to 70% effective, but it's our best measure that we have to prevent flu. It's protecting against 3 different strains, and there's 2 A's influenza strains in that one and 1 B. We're seeing mostly A right now, so that's a good thing because it is some protection within that vaccine. And hand washing is the #1 prevention and transmission of disease, and I can't stress that enough.
Do you guys have people hospitalized for the flu?
We have not seen too many people hospitalized. Most of our visits have been in the emergency department.
Okay.
Yeah.
And have you guys been busy in the emergency department?
Very busy, very busy. We're seeing probably average to 20 to 25 a day, I think, with influenza-like illnesses. Not necessarily they're all testing positive for flu, but they have influenza-like illnesses.